esperando poner más dinero para el área preventiva, porque yo digo que ahí deben ir los esfuerzos para que realmente requiramos menos servicios de intervención o de rehabilitación, porque eso es más barato. No sé hasta dónde están los esfuerzos ahí para que eso se dé, y que también haya una nueva dinámica de los médicos, que sean más médicos sociales que de estar solo dejando medicina. No sé si hay una visión más futurista en eso.
Question is, what are we doing to try to help with preventative services and more going towards a more system of medicine that provides services to all? And at the federal level, what we did was we tried to pass historic legislation, as I said, that would get us to the point of providing people with better access to health care. It's phased in, as I said, by 2014, the exchange comes into place. It relies on private insurance to get your health care, which for me means it's a costlier way to getting health care than if you were to go towards a system like Medicare, which offers you private doctors and private hospitals, but through publicly administered healthcare systems. And that would have been, from my perspective, far less expensive, which would have meant we could have devoted more dollars to things like preventative care. The legislation did make sure you will now have, beginning in 2014, access to good preventative services at zero or almost zero cost. So that is good. That is something that I'm very proud of that is in the bill. Some of us fought very hard for that. But that's not till 2014. So you better stay healthy till 2014 to have insurance. And that's the difficulty. But it all costs money. It all costs money, and that's why it's so important that we move forward. Can I tell you that today or this year we're going to have the solutions for better preventative services throughout the country? Well, we just heard that Governor Schwarzenegger is calling for cuts in preventative services. If you're a woman who's receiving welfare money, you're in real trouble under this governor's budget, which doesn't just affect your services, the monies and the help you get to support your family day to day. It affects what's going to happen with your health care as well. There's talk of cutting money for physicians who take Medicaid, which is called Medi-Cal in California. All those things get impacted, and so it's going to be very, very difficult right now. But the more we have leaders who are very short-sighted and would rather sell you something that says, I'm giving you a tax cut on your registration fees for your vehicle, or tax cuts on your income, which again, the higher your income, the bigger your tax cut, the lower your income, the lower your tax cut, then we have less money available to do the things we need to invest in our children and our seniors when they need it most. So it's tough right now, but at least now we know that coming 2014, there will be a law in place that requires those who want to offer you insurance, health insurance, that they must include preventative care services. By the way, the law, which doesn't take effect until 2014 for those who don't have insurance, takes effect next year for those who are getting insurance. Now, if you're buying your insurance through the private market now, starting in 2011, you will get preventative services included. So the insurance companies will have to offer preventative care services in their policies to people who are buying them starting next year. That won't be through the exchange, that's just through the insurance companies themselves. All the way in the back, sir.